Good afternoon, everyone. Thank you for joining us. We're getting towards the end of this webinar series and discussing the Nurture Benefits pilot. My name is Michelle Beebe, and I'm the Chief Revenue Officer with the Small Business Association of Michigan. And I have the pleasure of introducing two of my teammates, Kevin Kincannon, he's the manager for the Nurture Benefits member care team, and Brianna Schumann, she is a member of that member care team. So if you do choose to participate with Nurture Benefits, these are also going to be faces and names that you'll get to know real well through this process. So a couple of housekeeping things today. The best way throughout the presentation for you to communicate with us if you have questions or if you want me to go into more details on anything. Kevin and Brianna are answering questions throughout the presentation. So they'll, if they can, they'll respond to those at the end of the presentation. When we wrap, they'll bring up some that they feel like they would like me to address personally, or give you some time to add things that you feel like maybe I missed or you wanted me to clarify through the presentation. This is, I think, my fifth or sixth one now. And so I hope that I'm to the point where I am doing proactively covering some of the most common questions that you have. But if not, please feel free to answer or put something in that Q&A and we'll take care of it. We'll also be adding some key links and places in which that you need to know to be able to connect with us throughout this presentation. At the end of the presentation, you will also, we will be sending later today a copy of the slide deck for those of you that have attended, and a copy of a recording copy as well. So you can go back and to listen to that and see any information that you might want or to share with someone that you within your organization. So with that, let's get started. What is Nurture Benefits? So Nurture Benefits is a Michigan multiple employer welfare arrangement. Easy for me to say, right? So this is going to be affectionately called a MIWA throughout the rest of the presentation. But essentially, what this is, it provides a unique way for us to pull employers. So this is an employer offered benefit. So it is up to the owner of the business or a business person within the organization that's authorized to make these kinds of decisions to be the decision maker to offer these benefits to your employees. And it allows for multiple employers to come together, regardless of size, from the same industry to be pulled together as one large group. So if you, if you called the carrier or had any questions with the carrier and you were like, hey, I'm with ABC Child Care Provider Center, they're like, I'm sorry, I don't show you that you're enrolled. Then if you said, hey, I'm with Nurture Benefits and here's my group number, they would see you. So Nurture Benefits is actually going to be the insured customer when we move forward, because all of you will be in one giant pool. It's very similar to like what happens with the state of Michigan. All of the multiple entities within the state of Michigan come together, or GM. So it allows for us to start to build a pool of all of us together to have some leverage in how we offer benefits and eventually be able to set rates. Nurture Benefits was created as a subsidiary of the Small Business Association of Michigan. It's a limited liability company that's governed by child care providers. And why we pursued setting up Nurture Benefits was we were reached, myself and Brian Kelly, the CEO, we both received some connections from the state asking if we had any interest in maybe putting a proposal together on a PDG grant that was being filed at the federal level to be a recipient of putting together a solution for childcare providers for employee benefits. And so after long discussion, I put together a formal proposal that was part of the federal proposal, and it was approved. And so it's a part of a federal grant that is a 2-year pilot to help licensed exempt childcare providers specifically have access to affordable employee benefits, including health, dental, vision, life, disability, and retirement. And we're going to get into it. So that's who and what Nurture Benefits is, why it was created, and all of the kind of meat behind it. So why did the state come to us about this in the first place? Why is it a need? I think it's kind of obvious because you're my audience and you know how expensive healthcare is today. You know the struggles that about what we find from all of our surveys. We've done surveys and the state has done surveys that only about 35% of your workforce is actually receiving health benefits through their employer. They're either on the marketplace or on Medicaid and on a lot of occasions, or they may have spousal coverage too. But there's a large percentage that are or going uninsured. So, and there's so many challenges to you in your industry. Financial burdens, slim profit margins, you're in the business of children. So lack of affordable employee benefits just in the nature of the economy and the healthcare market in Michigan, workforce shortages and wage disparities. So allowing for you to be able to compete and have a competitive talent market. And there's also a lot of turnover in your industry of your employees. And so we felt it was very important for us to not only allow for this to be a benefit that is offered from the employer, because we want your employees to recognize that this is a benefit that's being offered by you, through you. And we also want to take all the administrative and regulatory HR complexities off the table for you so you can do what you do well. As I mentioned, I'm the Chief Revenue Officer for the Small Business Association of Michigan, and you're probably like, why in the world is SBAM in the mix on putting together a MIWA? So good question. And we've been been around for 50 plus years. We were established in 1969. And we have a very simple mission. So this fits our actual mission for an association is the success of Michigan small businesses. That's it. That's as simple as our mission when we were approached by MyLeap in the state of Michigan to maybe put our hat in the ring to put a proposal together in this space. One of the reasons why they even had us on their radar is we also have 30 plus years of doing benefit administration. So we also have another subsidiary called Small Business Insurance Services that is specifically created for the association to do third-party administration of health and life programs. We do a consolidated bill, which we will leverage in this space so that if you are subsidy eligible, we will send you one bill minus the subsidy. And if you choose multiple benefits, whether it's health and life, all of those things will be on one bill, one check, make things as easy as possible for you. And then one of the things that I want to point out is that some of you may be under 20 in size on your payroll today. And with becoming a member of and enrolling through Nurture Benefits, you now will be, because you're a large pool, you will now be COBRA eligible. You and your employees will be COBRA eligible, and you will need support for COBRA administration. And we today have an existing COBRA team that is experts in this space and know how to do all the heavy lifting for you. So that's also part of this package and free of charge to you as an employer. Also free of charge to those of you that enroll in the health and life benefits through Nurture Benefits to get this free as part of Nurture Benefits as well. So some of you may already need COBRA administration and be doing that. Just want to let you know that it might need to be on your radar that we can take that off your hands and support you through Nurture Benefits. Some background, I explained a little bit of this on the first slide. MyLeap awarded SBAM part of the PGG 5 grant to help make sure the childcare sector was more attractive to for talent and to promote worker retention. One of the things too, I know with I've been asked this a couple of times about the federal government shutdown and how is that impacting anything in this space. wanted to kind of be clear, those funds had already been released to the state of Michigan and that we're not being impacted by that. So there's no weight on us getting access to funds. It's already here in Michigan. These grants are going to be used, and they already have been. Some of it's been used because we've been building this for you since probably March of this year. The grant funds are being used to create benefit platform for childcare providers and subsidize insurance premiums. And the whole aim is for access to care in this space um and really provide a full package for an employer to offer to their employees. As I mentioned before, and I think it's really important to clarify, um, Kevin and Brianna and I aren't over here like, putting our heads together and creating benefits that we think work for you, but we actually have a board of directors that give us their direction. And they're made up of childcare providers. So this is being built for you with and directed by childcare providers here in the state of Michigan. We obviously know insurance and we know what we're doing in that space, but we don't know your industry, and we need to make sure that we're meeting the needs of you and your employees. So we have 6 childcare providers, 1 staff member that's on the board. That's me. My job is to just really do the housekeeping pieces of things to bring them the information that they need to make decisions on and then execute on those decisions. One of the things that the board had to review was plan and benefit approval. And we had to look at some pros and cons of why we went with a MIWA. And the MIWA was really the only way that we could allow for coverage for all childcare providers. So one of the biggest hurdles for those of you that are an in-home or family home provider is sometimes you are the only employee and there's not a group benefit available to you. And so the MIWA was the perfect solution for this because it doesn't matter what size of the business, you're all on an equal playing field. And then key things that I want to, and again, this slide deck is going to be sent to you, but key things that I think I just want to make sure that are on your radar. Big date for you to remember if should you choose to participate or are interested is we officially launch on November 15th. And I'm going to talk more about what does that mean, what's happening on November 15th. But that's when, if you want to start to enroll and our team to get you set up, November 15th is a D-Day. First eligible effective date is January 1 of 2026. This is unlike if you're doing business with the federal government and you're on Marketplace or even Medicaid, where you have a very specific date that you have to make benefit plan choices and have a specific open enrollment. You do not have a specific open enrollment with Nurture Benefits. The first effective date is January 1, but should you want to decide to, like maybe you already have group insurance and you renew in June, you can make that decision in June and make those choices then. You don't necessarily have to feel the pressure on November 15th to enroll your people. And then, as I mentioned, enrollment is all year long. So the rates that I'm going to show you today and the plan design that I'm going to show you are the rates that are going to hold for all of 2026. So if you do enroll on, like, let's say a June 1 effective date, those rates are only going to be good for 6 months. And then we're going to get a new set of rates. Hopefully we're going to go down because we're going to have great participation and the pool is going to perform really well. And so we're going to be able to negotiate lower rates. But that's my dream with all of this. But I just wanted to be clear that those rates are guaranteed for 12 months. Who's eligible for benefits? So the requirement is that you have to have an active state of Michigan license or be licensed exempt. And we will be confirming this with the state at the time of enrollment. Who on your staff is eligible for benefits? Employees working 30+ hours a week are eligible for benefits, and then they're eligible for benefits after 60 days of employment. So on that 61st day of employment, they're eligible for benefits. Again, center-based family home and group home eligibility all the way down to 1. Also, just key points here because they're common questions. Dependents ages 19 to 26. are eligible to enroll, and they are eligible to stay on your plan as a dependent through the calendar year of their 26th birthday. And then domestic partners, we also have allowed for domestic partners to be eligible for the benefits, regardless if there's a legal marriage there. There are some requirements for a domestic partner to be eligible, but we did include that option in this plan. Now, these are, the key things that we're starting to get into, the nuts and bolts of this. So who and what is how does the subsidy work? So first of all, I'm gonna kind of start with the second bullet first and then flip to the first. I find sometimes that flows a little bit better, but the first bullet here is, so the state of Michigan was awarded, as I mentioned, a grant. How much of the funds that were set aside has been set aside for subsidy? $1.8 million has been set aside for grant subsidy annually. And to me, $1.8 million sounds like a ton of money, and it is. And again, this is an employer program, so you will decide how you want to proceed because as the owner of the business. And with that designation of that much money, and it was decided and how we would offer benefits, the 484 employees will be eligible annually for the subsidy. And this is how that's going to work. So the subsidy actually is 50% of the base single premium rate of our PCP focus network benefit. And I will show you here in a minute more details on the plan design. And then that 50% translates into $291.33 per month per employee on health and prescription. It provides $16.20 cents per month per employee for dental benefits, and $2.50 per month per employee for single rate on vision benefits. Vision dental benefits are pretty inexpensive, as you can see. So how are we going to decide who's subsidy eligible? You're going to fill out an attestation form on November 15th. Remember, I said that was an important date. So you'll want to make sure that on November 15th, if you are interested in being subsidy eligible, you will want to complete an attestation form. I'm going to walk through that attestation form in the next slide. But questions are weighted to enter a lottery. So it is going to be a lottery system. Higher scores on the attestation form will have more entries in the lottery. Everyone gets in the lottery. All it means is those that have entered the lottery, and depending on how answers are put on the attestation form, you may just have more entries, and so giving you more options to try to qualify for the subsidy. And then also we're going to be taking into consideration county level data to ensure that we have statewide representation. There's going to be, as I mentioned, the subsidy application. It will be all web-based. So I want to make sure that you understand that it will not be humans making this decision. We've written an algorithm that will be making the decision through the lottery so that it's fair and equitable based on these answers. So some of this is just demographic information, owner name, email, phone number. If it's not the owner that's applying, who is the employee and what is their title? Are they an approved decision maker? We're going to need obviously the business name, your federal ID number. If you file a Schedule C and you're a sole entrepreneur, your social security number will be needed, and your active state of Michigan license number. We'll need your county information because we want to make sure that we are subsidies being offered in a equal manner throughout the state of Michigan. We'll need your phone number and your email, and then we will need employee demographics. How many of your employees work 30 plus hours, and how many of them are what we're considering part-time and work less than 30 hours. I also want to clarify, because it's a common question, well, what if they work 30 hours only in the summer, and then they go down to less than 30 hours for the rest of the year? Then they would not be eligible for benefits. You'll want to use the gauge of 30 plus hours on an average of 9 months for the year for them to be eligible for health coverage status. We are going to be asking also if you currently offer coverage, if you offer coverage but aren't able to contribute, or if you offer and contribute to your group health coverage. And if you do offer coverage through you as an employer, we'd like to know, if applicable, the name of the carrier, the insurance carrier, whether it's Blue Cross, HAP, Aetna, whatever, of who you're offering benefits through today. And then we'd also like to know whether all employees are going to be offered this benefit. Maybe you're offering it to a segment, like your lead teachers, or, all of the administrative staff are going to, like however, if there's going to be a segment. And we need to know this information because if you qualify for this subsidy, we want to make sure that we're setting aside the right amount of funds to make sure that if 100% of your eligibles picked benefits, that the money is set aside for them. Obviously, it's going to have an electronic signature and date, and then there will be an additional form that needs to be completed with your employee census so that we make sure that we can help you have an accurate picture on cost, and we can build, and I'll talk about this in a little bit, what the team's going to do is build, if should you choose to move forward, build your employer information and all of your employees in an electronic enrollment process. As I mentioned before, one of the things that the board had to evaluate was what carrier are we going to use? What benefits are we going to choose? And so way back in the spring, we put out a request for proposal to all the carriers that write business here in the state of Michigan and asked for them to come forward with their best offer on what benefits can be, in this particular case, in a MIWA that can be offered to nurture benefits. And so based on the feedback and the information we received back, we decided, the board did, to move forward with Blue Care Network. And Blue Care Network is the HMO subsidiary of Blue Cross and Blue Shield, but we wanted to make sure we were meeting some standards that were important to us. That one, we would be able to offer a base, mid, and high level plan of benefit, but we also really were concerned to make sure that we were able to offer benefits and participating providers throughout the state of Michigan, and then everybody would be truly eligible for benefits. And this just was the right fit for meeting all of those needs. So our base plan is an HSA high deductible plan. I'm sure you're all very familiar with that language, but what that means is that there's most of the benefits are subject to deductible prior to benefits being covered. So there's a $63.50 per member deductible. And then, but there's no co-insurance. So once an employee has met that deductible, everything's paid at 100%. And that includes prescription benefits as well. Also, so there's no fixed copays, any of those kinds of things. So like going to the doctor, hospital, any of those things are paid at 100% after deductible has been met. And then, but I do want to be really clear, all of these programs are not they do not have deductibles on any preventative services. So your health maintenance, taking care of your health, all of that stuff is going to be covered at 100% regardless of which plan that you choose. The mid plan it is not an HSA plan, but it is a deductible plan. You'll see here that it's a $4,000 for that on a single deductible, but it has fixed copays. So as you can see here, if you go for allergy, office visits, urgent care, any of those kinds of things are going to just be a copay out of pocket and not going towards your deductible. So you don't have to satisfy your deductible before taking advantage of those services. And co-insurance comes into play after deductible for certain services. A lot of that falls into hospital and diagnostic services. And then there's a high base plan there. As you can see, it's a $1,500 per member on the single deductible, and very similar to that mid plan, you have copays. And there are some pieces that are subject to deductible and copay, but most of these things are flat dollar amounts when you go to the doctor. And then the mid and the high plans both have flat prescription cards to them that are not subject to deductible. So I felt like those are the key things that I wanted to at least point out. And again, all of these cover preventative services at 100%. Dental and vision, you have some options here. So one of the things when we did our surveys and got feedback from all of you, having access to dental and vision benefits was seemed to be pretty rare. And so we wanted to make sure that this was at least an offering. You do not have to give it to your employees, but it is there, and it should you be interested in that, we will be providing subsidy dollars if they choose to do dental and vision. So as you can see, it's a blue dental PPO. Class 1 benefits are paid at 100%. So very similar to like on the health side, everything that's paid at 100% for what is considered preventative, your exams, your cleanings, all of those kinds of things are paid at 100%. But class 2 services are, they do have a deductible. It's $50 on a single or $150 on a family. And what that means is that that has to be satisfied, and then Blue Cross covers 50% of the approved amount after deductible. Class 2 and 3 are exactly the same. And class 2 benefits, if you're not familiar with how dental works, is typically x-rays and fillings. And then class 3 is usually like your bridges, crowns, and dentures kind of fall into that category. On the VSP Vision, VSP, I don't know if you've heard that name before. They're a partner with Blue Cross and Blue Shield, and they're the largest vision carrier in the country. They it would be very, I've never not found a VSP doctor for someone that uses glasses all the time. And so benefits are allowable for 12 consecutive months. Eye exams are paid at $10. Prescription glasses and lenses and frames are um, and or frames are a $25 copay, and then medically necessary contact lenses are it's a $25 copay as well. So you also could decide, hey, I don't want to do the health benefits, but I do want to offer the dental and vision. You can do that as well. So you can split these apart and do what's best for you as an employer, but you can't do 50% here and 50% there. Whatever you choose as an employer, it has to be offered. Otherwise, you have some discrimination issues. And so you need to make sure that you're offering the full line of benefit to everybody, whatever it is that you decide. Now here's the rate comparison. I hope this is showing up big enough on your screen that you can read this. So and on the, as I mentioned, that 291 for a single, you're like, well, where did that rate come from? This is where it came from. So on the base premium plan that I talked about, that HSA plan, on the Focus PCP Focus benefit or network, it's 582.66. And that is where the subsidy is going to come into play. It's going to be paying for half of that. Also, I want to point out, and we're going to talk more about all of the resources that are available to you, but on our site, we have a lot of information about the network, access to the doctor, what's the difference between a PCP and a the focus versus non-focus. All of that information is on our site should you want to take a look there. So you can see that there's Focus just allows for a little narrower of a network for the employee. So the narrower the network, the less expensive of the plan. So as you can see here, there's the rates for the single, two persons and families, or doubles in this case. So a double is just that, a double, any combination of two. So could be a parent and a child, or two spouses. On a family, it's any really combination of three. It could be a parent with two children, or a spouse and a child, but any combination of three that are enrolling qualifies as a family. And then you can see down below the dental rates for a single. This is where we were showing that we would pay half on the subsidy of $32.41, and half of that vision rate, as you can see, those vision rates are pretty inexpensive, is $5 and a penny. So that's the rates. I'm also going to reiterate, and I know it's tough to see that we can only offer subsidy to 484 people, and that's really honestly what $1.8 million translates into at 50%. And I know that I've been working with MyLeap and in a lot of other areas to see if we can raise some money to extend that subsidy number so that we're offering that to more people as the pilot goes on. But it's a bummer. And I also had a lot of questions about how do these rates get calculated? These are more expensive for some of you than what you're paying now. So unfortunately, remember when I said, I was hoping that, when we come to our renewal that our rates might go down. So, why I said that is because right now, when we went and talked to all of these carriers to ask them to give us their best rate, they don't have anything to base our rates off of. We don't have an existing census. We don't know how many people are going to enroll. We don't know what kind of risk we're going to have because as an insurance company, that's exactly what they're looking at is risk. What are our claims going to look like? How many, surgeries are we going to have? How many, they take all of those things into consideration. And so they ask a lot of questions about the demographics, the age of the group, all of these different things that come into play to help their actuary team because they have people way smarter than me that make the decision based on, okay, we're going to need this much money to make sure that we could cover claims because that's our goal is that we are breaking even. I don't want Blue Cross to make money and I don't want them to be because if we have claims experience that's higher than what we've collected for premium next year, we're going to see an increase, right? But if we are doing our job and making sure that we are building a pool that is really solvent and can stand the test of time, then we can start to see those rates and those costs get leveled out and potentially have that leverage for us to negotiate lower rates. I just did a lot of insurance speak, but I have gotten a lot of questions about why do the rates look like this? And I just wanted to kind of share a little bit behind the scenes on how we got where we did with the rates. Wanted to share that we are partnering with One America Financial and we are offering term life benefits. That these are again employer offered benefits. You can choose a flat 10, 20, or $50 amount. Your AD&D is going to match the life amount. It is a guaranteed issue. Rates are guaranteed for 2 years, so they'll be locked in for 2 years, and 100% employer contribution and 100% participation requirements. And then there are some stipulations here. I'm working with One America. I'm hoping to loosen their belt a little bit on some of these restrictions because they right now, I want to point out for groups of 2 to 9 employees, family content is the term that they're using, cannot exceed 50%. So that means that if everybody working for you is a member of your family, then that would make you ineligible for benefits if you have less than 9 eligibles. If you have 10 or more eligible employees, family content cannot exceed 30%. So typically that puts things at more risk for the life insurance carrier, and it's a very common stipulation. But since we are a large pooled employer, I do think that there's some room to negotiate, and so I'm still negotiating these benefits on your behalf. So more to come here. Term life benefits, just to give you an idea of the rates that we've been quoted. So per thousand, it's 28 cents per thousand for life and 0.02 for AD&D for groups that are 10 plus. So if you have 10 plus eligible, these are your flat rates. If you are a 2 to 9 eligible employee, these are your rates, and your age rates are based on age rated. This is also a section that I am negotiating, and that all of our employers, because we are considered a large group, that all of you have the same rating factor versus the age banding. So more to come there, but those are at the worst, those are worst case scenario rates. Wanted to share with you, and this makes me really geeked and excited that so many of you have been interested in our pooled retirement program. So we currently have what's called a PEP. It's a pooled employee plan that is for specifically for 401ks. We partner, we partner with Transamerica, and they are the fiduciary that is the investor behind the scenes for our program. We also have a financial advisor that we work with. They're called Greystone Consulting. We try to work with small business owners as much as we possibly can. And they do all of the help you through the paperwork, explain how the pool works, getting your employees set up in the plan, all of those kinds of things. And again, they do all of the pool plan, they're like behind this, do all of the work for you, the oversight. Some people step away from doing a 401k because they're concerned about making sure that they filed the proper documents, the 5,500, and do I have to have an audit, and the cost of all of those things are additional costs for doing business. Well, if you participate in this pool, those things are waived. And also, if you're a first time employer offering these benefits, there's a lot of tax advantages for you to take advantage of that most likely pays for itself in the first year. You can have, so we do one combined 5,500 and a single audit for the PEP. So everybody's included in that in the PEP. There are some groups, depending on their size, that will have to have their own audit and their own 5,500. Again, we take care of that for you, and the audit costs are included in fees, and it's at a significantly reduced amount. And usually this is going to be the larger centers that would be eligible and need to have that separate 5,500. And we do take care of all of that for you, but it is unfortunately that's not built into the cost. That would be an additional cost, but it's at a substantially reduced fee. So there is a high level information here about the 401k. There's more specifics that are on, again, on our websites and our service portal that you can pull down. And if you're interested in this, you can connect with the team and they'll get you connected with Greystone Consulting to make sure that you have someone that you don't have to wait till November 15th to talk about these things. So you can get going on the 401k as soon as possible. All right, some important things for you to make note of that you're kind of like your own little checklist for this. Create an online account at this link here, and Brianna's going to drop that in the chat in the Q&A, so you have access to the links right from there. But I highly recommend, if you're interested in any of this, to go ahead and create an account on our service portal. So this is our service portal to allow for, you can create tickets, talk to the team there. You can do it if you're working at midnight and you've got some questions, send them a ticket and they'll take care of you. But there's all kinds of, on our knowledge base section on our service portal, all kinds of details about all of the things that I just went over today, and a lot greater detail on the plan design, on the health benefit plan design. There's what's called benefits at a glance on there, and they have all the details of any kind of thing that any kind of service that you would have on the health and prescription side. It clarifies all of that stuff in a deeper dive. So if you're interested, it's there. Reminder, November 15th is, or later, to complete your employer attestation form. What to expect. So after you complete your attestation form, you will be put into the lottery. The staff's going to do some underwriting check to make sure you're a viable business and that you're active, your license is active and everything checks out. And then if you have been awarded the subsidy in or not, one way or another, you're going to hear from the team. We're hoping within no later than 5 business days. That's, I think, going to be really long. I think we're going to get responses to you within 24 hours, so you can make intelligent decisions whether or not you want to move forward if you've been awarded subsidy or not. So you're going to hear from the Nurture Care staff. If you decide to move forward, they're going to go ahead and set up your employee information in our Nurture Benefits enrollment platform. They're going to get you your benefits set up. It allows for you to have options if you do want to contribute towards premium outside of the subsidy. So if you are subsidy eligible, you can still decide that you want to offer employer contribution or not. It's up to you, but they'll walk through with you to get your contribution set up. And then that census, remember that census that I referred to that we're going to need when you apply, that's going to be really important because that's going to help us load that census into the system for the employees, so that when it comes time for, once you've done your part, decided what you want to do for employer contribution and what plans you want to offer, you can go ahead and that'll all be set up in the portal, that they can do their life and health enrollment in there together. And we'll send an invite to all of the employees, and everything's going to be done electronically. They can do that from their phone or from a computer for them to go ahead and do the enrollment. There's going to be some paper in a paper form, but it will be a PDF for you to be able to sign some enrollment paperwork, because we got to have our I's dotted and T's crossed, because there's a lot of federal or state regulation with the MIWA to make sure we have the proper documentation. And then employees will make their elections, and we will also be sending you COBRA paperwork, as I mentioned in the beginning, because we need to make sure that we have all of your compliance pieces taken. There are some of you that may be nonprofits and are ERISA exempt, and you would not have to do the COBRA paperwork, but 9 times out of 10, we will need you to do that, and to make sure that we take care of your compliance in that space. And then just a little more information about our team. So as I mentioned, Kevin and Brianna here, they're not the only ones. We have a team that's here that's dedicated just to supporting nurture benefits. They are licensed insurance agents. So some of you already have an insurance agent, and unfortunately, because this is a MIWA and the way that this is set up with the state, we will need, they will not be able to sell this benefit. So we wanted to make sure that you had licensed provide or insurance agents available to you to provide consultation and questions and support should you need that. So they're here. One of the things that you'll need to be compliant is summary plan descriptions. Some of you are probably already doing that today, but we will be supplying those for you so you can easily make sure you're compliant and offer those to your employees. Again, all of the COBRA compliance pieces for your ads and terminations and all of those things, your compliance notices, so that you're staying compliant, and all the regulations, we're just going to take care of all of that stuff for you. If you're more of a I need to talk to someone on the phone kind of person, we're here for that as well. Our lines are currently open. Our phone number is 517-594-4355. Again, this is how you can reach us. The myfuture.freshdesk.com this is our service portal. We also are nurturebenefits.com is our website. So we have both of those places that you can go to get information. The service portal is where you can talk to the team. There's a lot of information out there, but there's also additional information on our website. So both of those, we have a lot of crossover, and that information is in multiple places to make it easy for you. We also have our own social media, LinkedIn accounts and Facebook accounts. Should you, I know that I got a couple of areas of feedback that there were some there's some childcare chats on some Facebook accounts, and there were a lot of questions about nurture benefits and maybe a little bit of frustration that we weren't responding to them. We're not in those chats. And so I just wanted to let you know that if you wanted to ask us any questions or connect with us, you need to do those on the official nurture benefits sites. Those sites are specifically for childcare providers, and that's not us, that's you guys. So if you've got any questions, please come to us directly. Where the portal will allow for you to submit your required documentation, choose your plan designs, optional benefits. If you have, once we get going, you have any billing questions or contribution questions, we've got a team there. You can do that through the portal, or again, through a phone call. I think also there's an important piece to this too, is that we're not, like, once this gets up and going, we're not leaving you. We're going to be here through the whole year to make sure that if you have employees that have a baby or get divorced or all of these life changes that have to happen, they can do that right in the portal that we set up. And as soon as that happens, your bill will reflect that, as well as any COBRA notices and anything that needs to happen to make sure that you're compliant in that space. So there's going to be a lot of automation. Billing is going to be electronic, payment, ACH, all of those kinds of things to make this as easy as possible for you through this process. And then I mentioned a little bit throughout, kind of dabbling in this strategic sustainability. Obviously, we don't want to offer benefits and this just be a 2-year pilot. We need to build something that's long-term. In doing that, there's a lot of things. Having as large a pool as possible so that we can spread the risk. Working with maybe charitable contributors, founders, foundations that would be willing to donate to the subsidy. And then we're going to monitor and evaluate the effectiveness of this. Where did most people enroll? What kind of, how's the pool performing? Are we meeting the needs? Getting your feedback throughout this to make sure that we're not just launching and doing things in a vacuum. So we'll be checking in to make sure that that we're doing, it's doing what it's supposed to do. And we also want to keep an eye on rollover work in your talent area to make sure that because the goal of this is to help with um continuity of care in your on your side and making sure that kids have the same lead teachers and the same support staff there every day, because as we know, that's all very important for our future. And then stakeholder engagement and communication. If you know of anybody that you think in your community that might be interested in contributing towards the subsidy, or someone that I should present to or talk to, please reach out to me directly. My information is on all of our websites, but it's just michelle.bb@nurturebenefits.com should you need to get a hold of me. And always there to help support in any way that I can. And my main function after we kind of get this launched is this slide. The strategic sustainability is going to be really key role for me moving forward over the next year. So with that, it is time for questions. How are we doing, Brianna? Any questions you feel like I need to ask? Oh, question and cost about 27-year-old versus 50-year-old. In this plan, there is no age rates for health benefits. Single rate is a single rate. So our program is not like a small group health plan. It is what we call composite rated. So single rates are the same regardless of age. And that was important to us because yes, huge disparity between a 27-year-old and a 50-year-old. Any other questions? Well, all right. I hope that means that you've got the answers that you needed for today. Again, we're going to be sending you a copy of this and for you to share. You know where to find the three of us. Hopefully, I've shared that enough throughout this presentation that you know where to find us if you need us. And we look forward to the privilege of serving you. I think this is such an important thing that we have the privilege to do. And thank you for your time today. Take care.